Assalamu alaikum. Welcome everyone to today's session of Imamia Medics International Women's Wing. We are here with a webinar on the stroke awareness in the month of May. As you all know, that this month is dedicated to the stroke awareness, and we are here for everyone to join us live on the Imamia Medics International YouTube page. Without any delay, I'll begin today's program with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Translation. Say He's Allah, the only one. Allah, the one taking care of everything. He did not give birth and He was not born, and He never had any equal at all. Sadaqallahul Azim. I would like to mention that today's stroke awareness webinar by Imamia Medics International Women's Wing is brought to you by the Connecticut chapter of Women's Wing. And from here, I would like to introduce Dr. Sheba Zaidi, who is coordinating the Connecticut chapter of Women's Wing. Dr. Sheba Zaidi is a board-certified orthodontist with private practices in Wallingford, Rocky Hill, and Simsbury, Connecticut. She obtained a DMD at Tufts University School of Dental Medicine and completed a fellowship in orthodontics and maxillofacial orthopedics at St. Barnabas Hospital, New York. Dr. Zaidi has served as a president, vice president, and treasurer of Connecticut State Dental Association and treasurer of Connecticut Dental State Association, and as a member of the Peer Review and CSDA Annual Sessions Committee. With that, I would like to welcome Dr. Sheba Zaidi. Thank you for joining us. Over to you. I request Dr. Sheba Zaidi to please unmute yourself. Thank you.
Welcome, everyone. We are delighted to have you with us as we unite to support our mission of providing humanitarian aid and enhancing health and education for underprivileged communities worldwide. Let me give you a brief introduction of Imamia Medics International. Imamia Medics International is a nonprofit humanitarian organization based in the US with branches worldwide, supporting needy and underprivileged communities. Founded nearly 30 years ago by Dr. Waji Rizvi, it offers a platform for Muslim health and science professionals to develop their careers and provide health education and services globally. The Women's Wing, led by Dr. Huma Naqvi, is one of IMI's most active branches, focusing on women's health and wellness, women's education and skills training, and women's empowerment. With 12 national and 6 international chapters, the Women's Wing operates locally and globally to achieve its objectives. So I am going to introduce, I'm actually going to hand it over to Varda to play the video regarding IMI.
For sure.
Imamia Medics International is one of the world's leading healthcare, humanitarian, education, and relief organizations that has been serving humanity for the past 27 years. What started as a noble effort of few friends in a New York basement has today mushroomed into a global initiative that has welfare projects running in 55 countries. Working for the poor, neglected, and disadvantaged people through various programs and helping improve their lives. Throughout history, the central role of women in society ensures stability, progress, and long-term development of nations. Since its inception, women volunteers at IMI have played a foundational role and acted as a pillar of relentless support in its long, painstaking, yet rewarding journey. IMI's Women Auxiliary is a platform for the motivated, and inspired women that are ready to change their world for the better. IMI Women Auxiliary is a step towards empowering women through provision of education, health services, and various training programs. To fulfill these, IMI's Women Auxiliary organizes seminars, skill development workshops, e-training and support sessions, career guidance, and financial support initiatives. Through its various working groups, the Women Wing intends to educate, change, and implement policies which help accelerate women's sustainability around the world. From transferring latest medical technology and research to students in war-torn Iraq, to providing primary, basic hygiene education to girls in impoverished Nigeria. Helping design innovative techniques to fight coronavirus in India, helping girls prevent childbirth mortality in Thar Desert of Pakistan. Free basic healthcare screening for the elderly and people without insurance in the US. Supporting future leaders with Flagship Nest program in New Jersey, an all expenses paid initiative where foreign medical students receive free stay, food, and career guidance. Zahra Social Networking, an initiative to address social issues such as mental health amid COVID-19. Women's Wellness Program that aims at educating women in adopting a healthy lifestyle. All these wonderful initiatives are possible thanks to the combined experience and knowledge of the diverse set of medical experts, academicians, and social workers that are an integral part of IMI's Women Wing. Yet, there's still a long way to go. Much more remains to be achieved, and through each step, we will need your prayers, financial support, and active participation. Our vision lies in growing IMI Women family one meaningful wing at a time, adding new members in our journey to empower women worldwide.
Over to you, Dr. Shiva.
Let me take this opportunity to introduce my co-chair, Dr. Mehreen Raza. Dr. Mehreen Raza is a psychiatric specialist in Hartford, Connecticut, with over 20 years of experience. She trained in adult and child psychiatry at Rutgers and JMS and is affiliated with Trinity Health of New England, primarily practicing at Mount Sinai Hospital. Dr. Raza specializes in treating ADHD, autism, anxiety, depression, bipolar disorder, and schizophrenia in children, offering both inpatient and telehealth services. So I'm going to hand it over to Dr. Raza.
Dr. Mehreen, you are on mute.
Thank you, Dr. Shiva. Stroke is one of the world's major cause of death, morbidity, and long-term disability. It is the second top cause of death in the world and the third leading cause of disability. It is very important to discuss and increase awareness about this disease or condition. And today we are very delighted to have Dr. Zahra Khan, who is our speaker today. And we would like to introduce her, welcome her. Dr. Zahra Khan is a Pakistani-American neurologist with subspecialization in neuromuscular disorders. Dr. Khan received her MD from Chicago Medical School at Rosalind Franklin University. She completed her internship at Rutgers University in Newark, New Jersey. She then attended Albert Einstein College of Medicine, Montefiore Medical Center, where she completed her adult neurology residency and her fellowship in neuromuscular disorder medicine. Dr. Khan is an associate professor of psychiatry at Quinnipiac School of Medicine and practices neurology at our Institute of Neuroscience at Hartford Healthcare in Westport, Connecticut. Welcome, Dr. Zahra Khan.
Thank you so much, Dr. Mehreen, for that introduction. So I'm just going to share my screen and let me know if you all can see it. Is everybody able to see the screen?
Yes, we can see it now.
Okay, great. All right. So thank you so much for that introduction, Dr. Mehreen. Let's dive right into it. Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. So today's topic is going to be stroke. I'm going to try to keep it as straightforward as possible. But if something doesn't make sense, please feel free to interrupt. So this is the basic overview of today's presentation. We'll cover what a stroke is, what the signs and symptoms are of a stroke, what a person should do if a loved one is having a stroke, and the takeaway points. So like Dr. Mehreen mentioned, it's fifth leading cause of death in the United States, and it's the #1 cause of serious disability in adults. So stroke is basically a sudden attack that happens on the brain due to a change in how the blood flow is getting to places where it needs to go. Colloquially, people may call it as a brain attack, just like people are familiar with heart attack, stroke, think of it as a brain attack. So normal blood flow to the various parts of the brain is important because it's bringing nutrients and oxygen to the brain cells, which are necessary to keep the functioning of the brain normal. And without an adequate and appropriate blood supply, then the functions of those different areas will be impacted. So there are two different types of stroke. Ischemic stroke, which people may be familiar with as dry stroke, excuse me. So ischemic stroke or dry stroke, and then there is something hemorrhagic stroke, which is commonly called a wet stroke. And then there is a different category, which is called a TIA or transient ischemic stroke attack or a mini stroke. So this is blood supply of the brain. I know it looks a little scary. It's a cartoon drawing and depiction of various blood vessels. So, we'll be going over this in a little bit more detail. Just to give everyone an overview, different parts of brain are responsible for different tasks in our body. So real estate, so to speak, is really important. So you can see a cartoonish drawing of how this area of the brain controls your leg movements and sensation. And then this part is important for your torso or trunk, and so on and so forth. So let me first explain what a transient ischemic attack is. It's a warning stroke, so to speak, or a mini stroke. The symptoms will depend on which blood vessels are getting impacted at the time. Like I mentioned, real estate is important. The old definition of a mini stroke or a TIA was any symptoms, stroke symptoms that are lasting less than 24 hours. That was called TIA. But then over time, this was reviewed because when such people would undergo imaging, they would find that even though symptoms have gone away, they still were found to have a stroke. So the revised or the new definition is that a TIA means you have stroke symptoms that may be brief, maybe a little bit longer. However, this is a crucial part. There's no evidence of a stroke on the MRI of the brain. So a picture is worth 1,000 words. So for whatever reason, if you look at this is a normal blood vessel, and through that the blood is flowing normally and going to places where it's supposed to go. When we have plaque buildup in the blood vessels, which is a common cause for these kind of symptoms, over time, either due to plaques breaking off, or maybe there is a clot that came from elsewhere or formed here, there may be interruption or disruption of this blood flow for some time. So either the blood flow will stop completely, or there may be less than normal blood flow getting to the downstream areas that can give you this mini stroke or TIA. And again, the two important points are you can only call something a mini stroke if all the symptoms go away and the imaging is clean. So if you look at a blood vessel scan, this is what we see in real time in the ER. Somebody's coming in and all of a sudden, this over here, you can see normal blood flow reaching all the appropriate areas, whereas on the left side, this is your left MCA artery. And over there, there's a abrupt drop of signal. So there's a clot sitting there or something else is happening there due to which you don't see any blood flow downstream. If that clot breaks off, which oftentimes it does, the person may get a complete resolution of symptoms. And in that case, it'll be called a TIA. When a TIA doesn't stop, when you have prolonged deprivation of that blood flow due to a blood clot, or you have a narrowed blood vessel that supplies the brain with blood, it causes either a reduction in the blood flow to the downstream areas or complete deprivation. And again, blood is important because you're getting oxygen and nutrients to those parts. When this happens and it goes on for a longer period of time, then the symptoms may stay and may not go away. And that's when you get permanent damage, which is called stroke. So for example, if you look at the image on the left-hand side, you'll see this, what we call a hyperdense blood vessel. This is a CAT scan without contrast. So the only thing that brightens up like that, and I know this is the territory of this particular blood vessel, that usually means that's a big clot. And if you pay attention to the rest of the areas on this image, take my word for it, these are the normal areas. This is how normal brain parenchyma should look like. But then you see this darker gray areas that tells you that this clot has been sitting there for some time and damage is already happening, okay? This is somebody who's a bit more unfortunate, same territory, darker area, and you already see if you follow this line, you can see that there is a bit of a shift. It's being pushed to the left side. So there is enough damage and swelling that even the brain can start getting pushed onto the opposite side. And that's what ischemic stroke looks like on a CAT scan. There are other symptoms. Again, real estate. So symptoms of the stroke, what symptoms you get would depend on which blood vessel is impacted, which area is deprived of the blood flow. So, this is a special area within the brain stem. This is a very crucial area. So if you have an ischemic stroke or a hemorrhagic stroke going on there, you can get a variety of these symptoms, from balance difficulties, swallowing trouble. They may have double vision. One half of the body may be weak. They may be feeling spinning sensation. Speech may be slurred, or they may get numbness or tingling in half of the body, and as well as nausea. So the second major type of stroke is the hemorrhagic stroke, aka the wet stroke. And this happens when a blood vessel ruptures or bursts open. And this leads to, think of it as a flood in one part of the brain because you're leaking blood within the brain tissue. And this again does the same thing as the ischemic stroke does. You're being deprived of oxygen and nutrients, which eventually leads to buildup of toxic substances in that area and leads to permanent brain damage. And this can be quite serious and life-threatening. So here's an example of bleeding within the brain. This is one of the most common areas. Hemorrhagic strokes or wet strokes tend to usually occur within the deeper structures of the brain. So you can see this is a hyperintense or bright signal on the CAT scan, and that's the area of hemorrhage. Again, if you look in the midline, there's not much of a push and whatever going on over here. And that's because these kind of strokes, as long as they're not there's not too much bleeding going on, they will not cause swelling. So on the other side, if you look at this one, this is what we call a lobar hemorrhage. You can see that this is not in this is in the deep structure. This is on the outer surface of the within the brain, and these hemorrhages can be quite extensive. And you can see, if you follow this line, you can see the midline shift here, so to speak. Oftentimes, these are life-threatening, and even if people survive them, they don't really do well, unfortunately. So I went over a few signs and symptoms, but if you want to keep it very basic, you should know this acronym, be fast. So the other clue is, how are these symptoms developing? If they're developing very, very slowly over days, it's probably not a stroke. You want to think stroke when there is sudden onset of symptoms, like within a matter of minutes, where somebody was sitting and talking just fine, and all of a sudden they lose their balance. They're saying their vision is blurry. One half of the face may be drooping. This may not happen in all kinds of strokes, by the way. So facial droop is not a 100% requirement. Their arm may be weak, or maybe their leg would be weak, or maybe one half of the body is weak. They may be having speech difficulties. Their speech may sound like they have marbles in their mouth, so to speak. And so time is of the essence. Time is brain. So you want to alert the medical emergency line right away. So this is a busy slide, and I apologize for this. Just to give you an overview of how many different flavors of stroke there can be. So, for example, if somebody's leg all of a sudden is weak, again, you're thinking hyperacute. जिसको कहते हैं minutes में बात होना, आनन फानन बात हो जाना. So कोई बैठा हुआ है, they're sitting, and all of a sudden उनकी टांग नहीं काम करी, just fine, कोई दर्द नहीं, and there's no pain whatsoever. So or उनका personality भी change हो सकती है. This is a particular term for that, So that's a stroke in a particular territory. That's the ACA territory. If all of a sudden somebody becomes weak on the right side of their body, and they're not speaking at all, and the person, and they were speaking just fine a couple of minutes ago, yeah, speech unki aisi hai ki it sounds funny. There's breakage of speech, so that term is aphasia. अगर उसकी ऑपोजिट साइड पे उसी ब्लड वेसल की टेरिटरी में ऑपोजिट साइड पे अगर आप देखें, सो वो इंसान शायद बोल पा रहा हो, however they may not look, they may start neglecting one half of their world, so अगर आप लेफ्ट साइड पे खड़े होके उस इंसान से बात करें, they will not respond to you, or they may not be able to look at you. Instead, if you go on the opposite side, अगर आप right side पे जाके देखें, they'll interact with you, they'll respond to you. So that's a particular kind of stroke syndrome. In other parts of the brain, किसी की vision impact हो सकती है, where again उनको दिखाई देना बंद हो जाता है, and half of their vision is gone. Left-sided vision, for example, नहीं नजर आ रहा उन्हें, half of the left world is gone. They may be confused, उनको थोड़ा memory problem हो रहा हो. So that's one of the PCA strokes can present like this. Lastly, there is this particular blood vessel which can be pretty scary, इसके stroke syndrome. So अगर कोई clot all the way at the top चला जाए in basilar artery, it can wipe out consciousness completely. Person can be in coma. They may or may not be able to move depending on कि कितना बड़ा clot है, कोई blood flow जा रहा है या नहीं जा रहा. If it is a bad enough situation, is essentially shuts off everything, the person will be comatose. अगर इसी blood vessel के कहीं mid में है, all the way top पे नहीं है stroke, यहाँ पे clot बैठा हुआ है, it's probably even worse because you can get what we call the locked in state, जहाँ पे इंसान, everything below the neck level is, I shouldn't say below the neck level, I should say everything is paralyzed, side by side, आंखों की movements भी नहीं वो कर सकते. The only thing they can do is up and down movements उनकी आंखों की बाकी रहती है. And the sad part is कि इनकी consciousness है जो that does not get impaired because the areas of brain that are responsible for consciousness of brain are located downstream, they're higher up. So वो spare हो जाते हैं. So ये इंसान basically अपनी ही body में कैद होके रह जाता है. It's a very painful situation for these kind of people. Sorry, I lied. That was not the last syndrome. Here's the last one. When you get a stroke in a branch of vertebral artery, which is the pica, this is a common stroke that we see. The people with this kind of stroke will present with all of a sudden balance is off. They may have nausea. They may feel like the room is spinning. And again, depending on how big the stroke is, they may have trouble clearing their secretions as well. So that's a cerebellar stroke in the balance center of the brain. So now, once you have recognized the stroke, okay, somebody's having a stroke, what should you do? Number one is अपने हवास कायम रखें. Time is of the essence. Alert the ambulance, medical emergency services wherever you are. Stay calm. Panicking actually makes things worse because then you will not be able to help the person who needs your help the most at that time. It's important to know when did the symptoms start because then it helps the medical team to determine कि आगे क्या करना है, कौन से steps उस इंसान के लिए reasonable हैं या नहीं हैं. Last known normal is very crucial, and this is something that a lot of people have trouble with. Last known normal का मतलब ये नहीं है कि आपने इनको कब देखा इन symptoms के साथ. Last known normal means आपने इस इंसान को last time अपनी normal हालत में कब देखा. So if somebody goes to bed at midnight and then they woke up and the family finds them, at 6 in the morning, that's not last known normal. Last known normal in that case would be midnight. And then knowing the medical history of the person is important. अब अगर कोई इंसान blood thinners के ऊपर है and they have a stroke, उनको फिर we shouldn't give that person blood thinners because that will lead to a catastrophe. And what kind of medications they're on, what kind of medical history is also important to know what kind of risk factors they have. And once you're in the hospital and everything is happening, then long-term recovery kaisi hai? What kind of things a person needs? Physical therapy, occupational therapy is very important for fine motor skills. Speech therapy, agar kisi ki speech impacted hai. So briefly, the takeaway points are know that this is a medical emergency. Just like you all think of heart attack as being a medical emergency, stroke is just like that. Think of it as a heart attack of the brain. Time is very critical. Jitni jaldi you can get the person the help, it's better. Stroke symptoms could recognize karna is important. So remember this acronym and hopefully it will be helpful. Stay calm and remember the road to recovery, depending on how big the stroke is. Was it the first time somebody had a stroke or is this their fourth or fifth stroke? So road to recovery will vary based on what's the starting point. And I believe that was my last slide. Thank you so much for listening, everybody.
Thank you so much, Dr. Zara, for this wonderful presentation. It was really informative.
Thank you.
And I hope we can, with some questions, we can all increase the awareness more and more for the
Absolutely.
audience. Okay. All right. So we'll move on to question, and we already have some set of questions, and then we will open that to the audience also.
Sure.
So if we want to see, if we ask you to explain what is a stroke for the audience.
So a stroke is a sudden onset of symptoms that results in permanent brain damage.
Yeah. Okay. And why is it so important to know? Because it can cause disability. So what kind of disability can we expect from a stroke?
So that, Dr. Marion, will depend on the location of the stroke, the size of the stroke, and what kind of baseline status you are dealing with, right? अगर कोई इंसान is completely fit and fine, right, and that person has a stroke, let's say अगर उनको left MCA stroke हुआ है, so that area is important for speech. That area is also important for motor control or strength in your right side of your face and your right arm. So अगर तो उस MCA की branch में हुआ है, पूरी की पूरी territory नहीं impact हुई, अगर छोटा stroke है, then they may just have a little bit of difficulty with language, or no, उनकी weakness जो right side of the face और arm में होगी वो mild होगी, so उनकी disability इतनी आप expect नहीं करेंगे, right? Whereas somebody else who has a full MCA stroke would right off the bat in the middle of the in the beginning of the MCA territory, main जो blood vessel है उसी का अगर आप वहां पे clot बैठ गया and the person couldn't get the help that they needed in a timely manner, then unfortunately you're going to stroke out the whole MCA territory. So उनकी language के दोनों aspects फिर impact हो जाएंगे, समझ आने भी और बोलने में भी उनको problem होगी, दोनों चीजें impact होंगी, और what we call global aphasia होगा उस इंसान के लिए, right? और the weakness in the right face and arm may be severe. Depending on how big the stroke is, even the leg can be involved, right? Because eventually जब आप deeper territories में जा रहे हैं तो वहां पे फिर leg के fibers travel कर रहे होते हैं. So, full MCA strokes, large strokes, they unfortunately have a large amount of disability. चाहे वो youngsters में हो या वो बड़ी उम्र के लोगों में हो. Kids do better just because kids are resilient. But अगर आप typical एक इंसान ले लें, average इंसान ले लें, 60 something years old, has diabetes, has uncontrolled high blood pressure, पहले भी stroke हो चुका है, and then they have a stroke, then उनकी disability बहुत मुख्तलिफ है एक ऐसे इंसान से जो 40-50 years का है, पहली दफा stroke हुआ है और small stroke है. So it varies.
So, what are the preventative measures that we can implement in our daily life for prevention?
So for prevention, I think it's important first to realize what are the risk factors of stroke. So number one risk factor is uncontrolled high blood pressure, which people, quite frankly, often, and they're like, oh no, I don't have high blood pressure, it's okay, it's just stress. But that's the number one risk factor for stroke. Unfortunately, it causes both kinds of stroke, hemorrhagic and ischemic stroke. And when it presents with hemorrhagic stroke, usually it's not pretty. So अपना blood pressure को control रखें, see your doctor at least once a year. Regular जो routine visits हैं वो करें. Make sure you're looking for risk factors. Stroke के भी काफी similar risk factors हैं जैसे heart attack के हैं, ठीक है? So blood pressure हो गया, high cholesterol हो गया, smoking is another big one, ठीक है? Being obese, severely overweight, that's another one. So all those things can only be caught in a timely manner अगर आप डॉक्टर के पास जा रहे हैं. अगर आप 10 साल में डॉक्टर के पास ही नहीं गए, you are gonna say मुझे तो कोई medical problem नहीं है, right? So it's important to know what are your underlying risk factors और फिर उनको address करें. Take your medications in a timely manner. उनके साथ compliance ज़रूरी है, exercise is good. So maybe 30 minutes, 2 or 3 times per week, is important. अपना weight control में रखना, stay away from smoking, those kind of things. And of course, drugs, no drugs.
Yes, Dr. Zara, yeah, these are the risk factors, but how, as you emphasize already, that high blood pressure is the very important risk factor. And so how can high blood pressure can lead to strokes?
So in 2 ways, we talked about ischemic and hemorrhagic stroke. So if you're talking about ischemic stroke, most of the time, with high blood pressure, आपकी blood vessels के structure में change आना शुरू हो जाता है. And because of that, eventually what happens, there's thickening of the blood vessel wall, and eventually it clamps down and shuts off completely. And as a result, you don't get any blood flow downstream. Yeah. If you're talking about hemorrhagic stroke, so the other kind of change that can come with high blood pressure is कि वो blood vessel की wall है जो वो weak हो जाएगी. So when there's too much pressure, then eventually it gives out and it bursts open. So those are the 2 ways that high blood pressure can do it. Diabetes does the same thing. Cholesterol does the same thing. Same mechanisms.
How does diabetes become the risk factor? What does it do with the vessel?
So diabetes, it's a huge deal. Unfortunately, in South Asian community, too many people have it and they don't take it seriously enough. Diabetes does so many things. So it causes damage to the blood vessels. It gives you kidney disease as well, right? So high blood pressure and diabetes are the two main things that can impact your kidneys. And then as a result of that, you can have even more downstream effect. So the same effect that high blood pressure and high cholesterol has on the blood vessel wall, diabetes over time will do the same thing to the blood vessel walls. So by the same sort of mechanism, it causes a lot of trouble. Diabetes के साथ you can develop high blood pressure because आपका kidney damage है, right? So gives you secondary hypertension because of that.
Okay, all right. And high cholesterol, then my next question.
Same thing. And I wanna mention one more thing over here. जो लोग cigarette पीते हैं, smoking actually accelerates the buildup of cholesterol, right? So chahe you're talking about the heart blood vessels or you're talking about the intracranial blood vessels, people don't realize it actually promotes inflammation, और उसकी वजह से you develop these kind of problems even at a younger age.
Right. So smoking actually from inside, smoking going to damage the vessel from inside, and the cholesterol and other cells of the blood will come and clump together.
Yep.
And that's how they're gonna close the vessel.
Exactly.
Okay. So can preventive measures be taken to prevent? You explained it all.
Yes.
But
अपने take care करें, take good care of yourself, a little bit of exercise, don't be a couch potato, so to speak, right? Sedentary lifestyle is problematic. So many things happen, right? With weight gain, for example, people develop something called sleep apnea, जहाँ पे वो सोते हुए एकदम से वो सांस लेना बंद कर देते हैं. That also increases the risk factor for stroke. Or when we're talking about all these other things, diabetes, high cholesterol, high blood pressure, these things also change the structure of your heart. फिर वो आपको और चीज़ों के लिए they put you at risk factor, at risk, right? So if the structure of the heart is becoming weaker, or agar high blood pressure uncontrolled hai, so then there will be thickness in the heart tissue itself, जिसकी वजह से eventually a person can develop various problems. They can develop cardiomyopathy. दिल ठीक तरह पंप नहीं करेगा. जब दिल ठीक तरह पंप नहीं करेगा, अगर खून वहाँ पे बैठा रहेगा, then you can form clots over there, और फिर वो clots जगह जगह जाएंगे. One of the big places it goes is to the brain. And then you can have a massive stroke from an embolus, right? Or it could go to your lungs and give you pulmonary embolism. or you can have arrhythmias. इन्हीं सारी problems की वजह से जब जब खून stagnant रहता है दिल के अंदर, you can have arrhythmias, you can form clots, you can also have arrhythmias. अगर structure दिल का change कर रहा है, तो think of it as अगर आपकी electrical system है आपका और आपने वहाँ पे उसको आप किसी तरह से फैला रहे हैं, तो उस फैलने की वजह से वो बिजली की जो तारें हैं वो impact हो जाएंगी, right? And then you'll get strange kind of arrhythmias from that, और उनसे भी आपका मजीद रिस्क बढ़ जाएगा.
Do we call it paroxysmal one? Initially, if it happened all of a sudden and patient didn't have any problem like that before, but you, because of high blood pressure, because of the changes in the heart structure, you're inducing a new problem, which
Yes.
can
Right.
be
So paroxysm का
Right.
मतलब है कि something that's not there. It's transient, comes and goes, right? Like you can't predict. So I think you're referring to atrial fibrillation, which is basically it just means that one of the chambers of the heart sort of quivers like this, and because of that, it's not doing what it's supposed to do. The blood is going to pool over there, and again, the same thing happens as I alluded to earlier. So because of that, a person can form clots, and again, those will go up to the brain and give you problem. This can go undetected in people for a long time. Previously, ये सोचा जाता था that this is a condition of the elderly. That's not true. It can even happen in people who are in their 40s. So sometimes, a 40-year-old who's coming into the ER, and we have done $1 million workup, we can't find anything. फिर उनकी जब दिल की monitoring हम करते हैं, which is part of stroke care when you're admitted,
yeah.
that's how we find, oh, okay, this was hidden. We call it occult AFib, छुपा हुआ. So that's how we find it. People can have it even at a younger age, and this is one of the major risk factors for stroke as well.
I do have a question from the audience. So besides obviously notifying 911 and giving a good clinical history, are there any other measures we can take at home immediately after a stroke?
That's a loaded question. Again, as a neurologist, I don't like saying, right away give aspirin. As long as the person is not on blood thinners and the family is aware of that, that's what they usually recommend, that okay, give them a baby aspirin at that time. But the conundrum there is that God forbid if that's a wet stroke, a hemorrhagic stroke, then that becomes a little difficult. I don't think that a baby aspirin would cause so much damage if it is a hemorrhagic stroke. However, if somebody has had let's say stenting, and they're already on two blood thinners, right, like aspirin, Plavix, then at that time I would shy away from doing something like that. Main thing is controlling the blood pressure. If the person hasn't taken their blood pressure medication, give them that, alert the 911, and if they're not on these antiplatelet agents, give them just a single dose of aspirin.
Can you shed some light on the difference between, the incidence, symptoms, or prognosis of stroke between men and women? So is there a difference?
Yes. So men in general, if you're looking at premenopausal women, men have a higher risk for stroke. It's much more common in men, and it's just, I think, may have to do with the vascular risk factors that men have. Women tend to be a little bit more cautious of whatever comorbidities they may have, so they tend to take better care of themselves in general. They also don't drag their feet going to the doctor, whereas men majority of the time may not go to the doctor, so may not be aware of what underlying conditions they have. So some of those factors play a role there. Postmenopausally, then the risk of women also increases, almost becomes similar to that of men for stroke.
Is there an age when stroke is more common?
Depends on your risk factors. So usually this is a condition that you see in people who are 50 and above. But if somebody really doesn't take good care of themselves, I have seen strokes in 30-something-year-old people as well.
And the last question, how important is the role of physical and occupational therapy in recovery?
Critical. So what you want to do is, as long as it's safe for the person to participate in those therapies, and we start these physical therapy, occupational therapy very quickly while somebody's admitted in the hospital with a stroke. As long as their blood pressure and everything else is stable, their oxygenation level is stable, and they're able to participate. It's crucial to get started on these therapies right away because of the ability of neighboring brain areas to take over the functions that were lost. So the earlier the better.
Thank you.
Sure.
Our sincere gratitude to Dr. Zara Khan for her informative presentation. Thank you for being a part of today's event and for your unwavering support. Together, we can create meaningful change and positively impact communities around the world. We look forward to your continued involvement with Imamia Medics International Women's Wing and hope to see you at your future events. Thank you, Dr. Zara, and may Allah bless you.
I would also thank you, Dr. Shiva. I would also like to thank the Connecticut chapter of the Women's Wing, and also would like to thank Dr. Shiva Zaidi and Dr. Mehreen Raza, and of course, Dr. Zara Khan for being part of this informative webinar. And also I'd like to thank the Imamia Medics International Media team for overlooking everything, and a sincere and much thanks to Dr. Huma Naqvi, the global chair of Imamia Medics International Women's Wing, for organizing all these webinars and informative sessions for everyone. So on behalf of Women's Wing, I would like to mention to all our audience that this program will be present on the YouTube page of Imamia Medics International, where you can revisit and rewatch and share this link with more people so that more people can become aware regarding the stroke awareness. With that, thank you everyone, and see you again, inshallah, in another episode of another webinar, inshallah. Thank you. Allah Hafiz.
Thank you, everyone. Love.